Oftentimes, what this looks like is sort of reliving the traumatic events in your mind, unwillingly. So having memories pop into your mind when you don't want them to, sort of being reminded and caught off guard by traumatic experiences in the day to day. There's a lot of emotional numbing that can happen. And then on the flip side, other times, like really intense emotions, including anger and sadness and anxiety. And then there's just a lot of fear that comes with unprocessed trauma as well. So people don't feel safe in their daily environment, even if they are objectively safe, their brains and their bodies don't feel safe, and that leads to a lot of avoidance of different aspects of the environment that might trigger unwanted memories or uncomfortable, like, physiological arousal or some of those states. And so if you have to think about avoiding certain places or people or things out of a fear of getting triggered or activated, your world just can get really, really small. You can get more and more isolated. And I think, other ways that people really, sort of notice that there's a problem related to these past experiences is a lot of like difficulty with like relationships, like not being able to trust other people, not being able to trust that people will treat them well, difficulties setting boundaries. I mean, it can look a lot of different ways and is a little bit unique person to person, but those are some of the most common ones that I've seen.
Yeah, definitely. I think we were curious about how trauma could manifest and kind of understand how individuals can recognize those signs to say, hey, you know what, maybe a trauma-informed support is something that is needed. So I think you mentioned that those are more commonly what people experience. And for people who do experience that, is there kind of like a first step that you would recommend, whether that's like a personal action or if it is just reaching out to a provider immediately?
Yeah, I think that, I would love to say just reach out to a provider, but I think, I think it's ideal that people understand like maybe the types of providers or the types of support to look for. So we know that there are two types of therapies that are best supported for helping people sort of work through traumatic experiences. So there's prolonged exposure therapy, which is what we offer at Rebound, which is essentially helping people get their brain and body out of survival mode by engaging in sort of storytelling activities to step by step in a very structured and guided manner, work towards reprocessing traumatic memories that they've been experiencing. So this helps the brain and body learn that these things are in the past. They're not happening right now, and just helps to emotionally process some of the difficult pieces of those memories that people have been holding on to. And then it also helps you to take small steps day to day to work through the areas of life that are being avoided because of the trauma. So just practicing going into those situations. And again, your brain and body get that opportunity to learn, okay, the trauma is over. I can actually go into these situations and be safe. The other therapy that is a gold standard is cognitive processing therapy. And that involves, sort of looking at the ways that our outlook on life has changed since the trauma or because of the trauma.